it just seems to be a battle, like you're walking through mud day after day after day.
Yeah.
We often see brain fog associated with gut symptoms and gut health. It seems
Mm.
to be a little bit different. It's the inability to focus on things long term, coupled with that loss of memory.
So let's talk about those two little gems. And this paper shows, yes, there is real potential there. How about we start with NAC, N-acetylcysteine?
Well, I'm currently using it myself, and
How about that?
yeah, just happened to be using both of these supplements. That's why it was really interesting when you brought this paper up. I know there's been a bit of research with NAC. I wasn't aware of the research with ALC, acetyl L-carnitine, and I found it very interesting indeed. And the mechanisms they talk about were fascinating. So yeah, it was great.
Yeah, so let's have a little talk about those two little gems because we use them a lot. So it's popped up here in this study about long COVID. So let's just touch on long COVID, shall we? So what are some of those symptoms you're seeing in clinic with long COVID?
Yeah, so we're just seeing fatigue is a big one,
Hmm.
brain fog as well, and it's not. We often see brain fog associated with gut symptoms and gut health. It seems
Mm.
to be a little bit different. It's the inability to focus on things long term, and
Hmm.
coupled with that loss of memory as
Mm.
well, or short-term memory. So noticeable effects on performance, especially
Hmm.
people who are in office situations and needing to think and present and so forth. They're really struggling. Obviously, you can have good and bad days,
Yes.
but when you have something like long COVID, it just seems to be a battle, like you're walking through mud day after day after day.
Yes. So let's talk about those two little gems and dig into why. And this paper shows, yes, there is real potential there. But then, of course, they always say more study and more research needs to be done, which is true. But right now, it's showing potentially promising. So
Mm.
let's dig into those. And how about we start with NAC, N-acetylcysteine?
Yep. Yeah.
Yes.
So NAC, for those who are not familiar with it,
Mm,
contains an amino acid, and the N-acetyl form of it is been shown to be very effective in increasing glutathione levels. So glutathione being a main antioxidant in our cells, very potent anti-inflammatory. So NAC has been shown to also reduce neuroinflammation in conditions such as depression and other mood disorders. So that is a possible mechanism in itself. And with respiratory infections, we also know NAC is very good at increasing glutathione in the lungs, in the respiratory system, also helping reduce inflammation. So when we
mm,
talk of COVID, we talk about things like cytokine storms and this sort of thing. So NAC can have a direct impact on those
mm,
things. But also in respiratory conditions, it acts as a mucolytic, so it thins out the mucus.
mm.
So it's very important nutrient for doing that. So it's,
Yeah, yeah.
but I guess these are probably more pointing to acute COVID, but with long COVID, to see its evidence there is really exciting, and to see the progression of evidence. We're seeing, like you said, it's 2025, and we're still getting good research coming in and showing the benefits of something like NAC in treating long COVID.
Yeah, and something so simple. Fun facts for those viewers. It's actually used in hospitals and they use it to protect against poisoning or overdose because it's really powerful at protecting the liver. So as Brad mentioned, it's that precursor for glutathione, antioxidant, and it's anti-inflammatory. So it protects the body.
Well, on that note too, glutathione, we have, yeah, because I wasn't that aware about paracetamol, treating paracetamol poisoning or its use in the liver in hospitals environments. But of course, we have glutathionation in that phase 2 liver detox pathway.
Yes.
It's a very good antioxidant in that sense because it works on that
Mm.
particular pathway.
Yeah, and it tastes quite sour.
Yeah, well,
Um,
it's got that strong sulfur taste to it, like, or smell as
yeah,
well. So,
but not that bad and so easy. And when you think about all of the benefits of it, it's very easy to, well, you can get it in capsule form as well, but I love mixing it in water and just shooting it back. For you viewers out there who have brain fog and maybe struggling with long COVID, it could be a really good one to dig deeper in and look at. It might be helping you.
yeah, yeah. Well, it also works systemically too. We have I mentioned, the respiratory system specifically, and we're talking about the brain when we talk about neuroinflammation and some of its potential actions. Also, the research paper talked about both NAC and ALC. They talked about the working on the glutamate receptors, and
Yeah.
glutamate, for people who don't know, is an excitatory neurotransmitter. By influencing that, you can therefore excite the brain or stimulate the brain. So acting
Mm-mm.
like a stimulant, but not in the sense of something like caffeine or other things that might raise
Mm-mm.
cortisol or what have you. There's a potential mechanism that this paper was looking at too. So again, there seems to be numerous mechanisms that could be involved
Mm-hmm.
here with treating long COVID. And I think the systemic effect it has, especially when it's the precursor to glutathione, which we know is a cellular nutrient that we use as an antioxidant throughout the body. We have this systemic anti-inflammatory effect throughout the body, which I think is very important for the treatment of long COVID.
Mm. And again, there was lots in there. So I'll summarize it for the viewers who might not get those technical terms. So Brad mentioned about glutamate and glutamate being a neurotransmitter. Think about MSG, monosodium glutamate. And that's one where some people, you may have a friend or family member who gets headaches, and that's because the MSG is breaking off. And it's stimulating the neurotransmitter function, and that's why it's exciting those people, giving them the headache. So they're sensitive to it. So that glutamate that Brad mentioned. So let's go in to the next one. So we've got acetyl L-carnitine.
Yeah,
I always
carnitine.
mess
Yep.
that one up. Carnitine. So can you give a little bit more on that? Why could it be helping long COVID?
Yeah. Look, ALC, acetyl L-carnitine. I'm messing it up now.
NAC.
Yeah, it's often been used a lot in the sports nutrition field because of its it's a key component to, or carnitine specifically is a key component to fat metabolism, within the mitochondria specifically too. So again, with COVID, we know there's dysfunctional mitochondria is a problem, which for people who don't know, that's where we're producing our energy. That's the little energy producing components of the cell. Carnitine can play or does play a significant role in doing that. Now, acetyl L-carnitine often used because it the ability to cross the blood-brain barrier and be utilized within the brain. So this is where it's likely doing its, or having a greater benefit when treating something like long COVID. So very good nutrient for fatigue.
Definitely.
Yeah, look, it's one that I've used. Well, I'm currently using it myself, and
Oh, how about that?
yeah, just happened to be using both of these supplements. That's why it was really interesting when you brought this paper up. It has a lot of benefits for improving cognitive function, also utilizing or helping us to utilize fat as a fuel source within the body
Yes.
as well.
It's definitely always in those sports, well, most of the sports formulas. And for me, it really gives me kind of a buzz when I take it. Definitely helps me produce energy.
I think I often used it back in the day for exams as well. It helped with that too. And to make a comparison, or to really associate it more accurately to long COVID, we talked about that sustained fatigue when we were referring to brain fog in COVID. That sustained fatigue feeling carnitine or acetyl L-carnitine does the opposite. It has a sustained energetic, can improve focus. It's really good in that sense.
Mm-mm. Yeah, and so we've looked at this study. We looked at two compounds and two nutrients for people with long COVID. Let's dive a little bit in, take a turn to other holistic things. So just touching on long COVID, can you think of throw a couple out there to help the viewer do these extra things holistically, naturopathically, that might help with long COVID as well, that will assist nutri these nutrients as well?
Yeah, well, just on the theme of brain fog and cognitive enhancement, I'm keen to try this myself. I do have this other supplement I'm about to mention as well, not in a combined formula, but you could, because all these come as powders. So NAC, ALC that we've just been talking about, have them together with creatine is something that comes to mind, because of all the current research out on creatine, and a lot of my patients who suffer from fatigue, I've been introducing to creatine. So 5 grams has been a dose that's been used time and time again, and we often see again in the sports nutrition fields, for muscle building and so forth, but higher amounts, up to say like 25 grams at a time, are being used for cognitive enhancement. So I think that could be a very interesting way to go with these supplements, combining all three, and working out the dose would be an individual thing. Creatine is quite well tolerated, so you can sneak that up in higher doses, but again, it all depends on the individual. And yeah, just on long COVID as another thing to keep in mind, things like quercetin have been shown to be very effective, because there's this whole mast cell activation syndrome, which is a condition by itself. And this is, without going into too much detail, this is another facet, kind of like a histamine allergenic type response, that's part of this inflammatory picture that long COVID has. Quercetin has been shown to be very effective in helping that as well.
Yeah, and just while you're explaining those things, it brought me back to that study and how there's so much complexity in these studies to break things down to individual compounds. But you and I, we're holistic practitioners, we're thinking about the patient in front of us, and we often say this. So when it comes to long COVID, there's really hundreds of different things to add to it, but what is working and what is it for that individual as well? So it's quite difficult to bring up something specific to the viewer because they're an individual. And even this study, why did those things work? Well, we threw around at the beginning about being mucolytic or being a precursor to glutathione, but at the end of the day, do we really know? Do they really know? They don't know 100% why it's helping long COVID, but it is.
Yeah.
Is there any other takeaways that you want to add?
Yeah, look, I think on your point about the individual, treating the individual, and what will work for some people won't necessarily work for others. And, the things we just mentioned, including the quercetin, you've got to get doses right, but it may not be appropriate for everybody. Like, there's certainly patients I deal with, and especially if they're developing a sensitivity, or especially to foods and other things, then it becomes a very complex thing to treat. And I don't know of any real or any practitioners out there who they're specializing in long COVID talking about any magical cures, so to speak, or really this is the nutrient, or this is the combination. And again, I'd go, even though this study's showing promise with NAC and ALC, what I'm finding with long COVID, there's a whole host of things. And we haven't even talked about herbal medicines, Siberian ginseng, astragalus, all these ones that work on fatigue, that we've used for post-viral fatigue syndrome for decades that we're already using, they can come into play as well. And again, you can get varied results depending on the individual. And again, you've got to assess the individual with good case taking, making sure you're covering all the pathology you need to cover, because sometimes it could be just nutrient deficiencies.
Yes.
Vitamin D is a huge one in this particular case. So
Yes.
you've got to get that right. You've got to get that right without overdoing it, because you can throw vitamin A out. So there's a lot of nuances. All the same, it's promising to see NAC and ALC coupled together like this, demonstrating good results.
Yeah, and hopefully it's giving you, the viewer, hopes that you can overcome this, and definitely can overcome it.
Yeah.
So with a little bit of guidance or taking the right things, you can do it and get your life back.